here. They looked for me this morning, too. This study was actually the brainchild of Neil Epperson, who's a psychiatrist who was at the University of Pennsylvania. She's now chief of psychiatry at the University of Colorado. And she was unable to attend, but we designed this because we're really interested, and she was interested in what happens with women who develop LUTs as far as in their childhood, as far as adversity. So I want to present the results of this. And these are my disclosures. And the funding was done through several methods at Penn. So basically, the brain and bladder are neurologically connected. Adverse childhood experiences, we're going to call this ACE, are associated with increased risk for a host of adult health disorders. So the aim of this study was to determine whether ACE contribute to increased risk of lower urinary tract symptoms and to determine whether ACE are associated with greater complaints of bother due to LUTs. We got these participants with or without LUTs from our database of other NIH studies we had and developed and entered women into database, and also from our urologic practice. These are the different questionnaires that we did. We did the ICIQ, which was just described, FLUTS, adverse childhood experiences, and then 3 other scales, which I'm not going to report on today. I'm just going to report on the ACE. The adverse childhood events questionnaire was developed and used in the collaborative study between the CDC and Kaiser Permanente in San Diego area. And you can see the different things that it asks and then the scoring system for this questionnaire. I don't know if you're familiar with it. It's evidently very much used in psychiatry to look at childhood adversity with advance and what happened. And it covers a wide range of areas that could occur. The ACE data was analyzed according to continuous 0, 1, 2, 3, or greater than 4. Examined whether LUTs frequency varied by ACE group, controlling for behavioral and demographic variables. LUTs was defined as a score of 2 or above on the, it should be the ICIQ FLUTs, indicating that symptoms occurs at least sometimes. And then we examined whether LUTs bother caused by ACE group, controlling for behavioral and demographic variables. And these women were mostly in their mid-60s. We did this in Philadelphia, so we had a nice representation of African American. And you can see the breakdown as far as socioeconomic, education, and marital status. And you can see as far as the frequency of LUTs, I know it's a busy table, but basically the top is urinate too frequently, 27.3%. You can see the high percentages of these women who had LUTs all the way down to associated symptoms. So we had a good portion of women who did report lower urinary tract symptoms. So what we want to know was total ACE score predict number of LUTs. And yes, for total LUTs at a p equals 0.038, and some it did correlate, predict total LUTs and also some individual LUTs. And we controlled for BMI, race, age, psych family history, substance abuse, vaginal deliveries, hyperlipidemia, surgeries, perceived stress, depression, and anxiety scores through other questionnaires. And again, this is the breakdown from 0 to 4 as far as using the ACE questionnaire. The other thing that we also found that there was bother, okay, in this population, depending on what the symptom, and what we looked at for bother was somewhat or greater as far as whether that symptom, and those are the numbers. So with bother as either a dichotomous or no versus any bother or continuous 0.4, women at all ACE levels were similar. In other words, whether individuals had experienced ACE or not, they experienced a similar degree of bother with respect to their LUTs. So LUTs are common, associated with considerable bother. ACE is associated with risk for LUTs, but not LUTs bother. We were really kind of surprised by that. We thought we would also see that correlation with bother. LUTs symptoms that are most associated with a history of childhood adversity include urinating too frequently, sudden need to urinate, and symptoms of stress urinary incontinence. ACE is associated with LUTs even when controlling for psychological factors such as perceived stress, depression, anxiety symptoms. As childhood adversity contributes to LUTs risk, screening and the urologic setting may benefit patients. Thank you. Has anyone used this questionnaire in anything?
Thaddeus Frank from Medtronic. Thank you, Diane. This is really nice. One quick question. So this is any childhood adverse event.
And you saw the list of all the things that they asked him, spousal abuse, anything at all. That's what the ACE is used for. There was a slide I didn't put up, but it shows you, actually, the states are reporting it now, and it's actually a picture of the United States showing the different states and how they're actually starting to track this.
So is there any sense, or I assume probably not high enough sample size here, but to try to kind of see if there's a way to certain kinds of childhood adverse events that might be a bigger predictive factor for kind of thinking about the likelihood of LUTs developing?
Well, I know we have a lot of data here, and because Neil was, transferring over to Colorado, we're going to work on trying to bring out more because we did so many questionnaires that she utilizes in the psychiatry field, so we'll see. So I really don't have that data yet, but you're right. It would be interesting to know that. But I think what's interesting here is we need to probably start asking about this, right, in practice. And we, for you who do research, there were so many pages of questionnaires you couldn't believe it. And what we did is we did some of this online and in paper, and then we did a prize at the end. We're drawing. We gave 4 prizes, and the women did it, and we got quite a nice number. So
that's great work.
Is it possible? I haven't used that questionnaire before, but does it adjust in any way for the individual response, or say individual bother in response to a specific adverse event? Because that can vary.
Yeah, this has been a really well-validated used questionnaire in psychiatry. It's one of the tops that you use to look at any type of condition, what happened in the childhood, on those different parameters. You see they cover a lot of different things that could have happened to that child. So yeah. I don't know of anything in LUTs though that that's been utilized.
So there's something that is not clear to me, or maybe I missed it. Did you have controls on the group?
Yeah, this is all. Yeah, we had women with and without LUTs, so they were compared with women who did not have LUTs, as far as childhood adversity. So the women with LUTs had a much higher.
Okay.
That it was compared without.
Okay.
And I'm only reporting on the 135 of women who had the LUTs.
Okay, perfect. Thank you.
Thank you.
Sorry, last question, Diane.
One more question.
Sorry, one last question. Lydia Johnson from Australia. That was really good. Do you know of any data on whether counselling or therapy to these women would help their low urinary tract symptoms?
No, not really.
Thank you.
Okay, thank you.